when I started to talk about women's health in general, I was like, well, what's going on in healthcare as a whole, and what's going on in women's healthcare in particular? And this is a fable that came from 1977. So if you will humor me, I'm going to read it to you. It was many years ago that villagers in downstream recall spotting the first body in the river. Some old-timers remember how Spartan were the facilities and procedures for managing that sort of thing. Sometimes they say it would take hours to pull 10 people from the river, and even then only a few would survive. Though the number of victims in the river has greatly increased in recent years, the good folks of downstream have responded admirably to the challenge. Their rescue system is clearly second to none. Most people discovered in the swirling waters are reached within 20 minutes, many in less than 10. And only a small number drown each day before help arrives. A big improvement from the way it used to be. Talk to the people of downstream and they'll speak with pride about the new hospital by the edge of the water, the flotilla of rescue boats ready for service at a moment's notice, the comprehensive health plans for coordinating all the manpower involved, and the large number of highly trained and dedicated swimmers always ready to risk their lives to save victims from the raging currents. Sure, it costs a lot, says the downstreamers, but what else can decent people do except to provide whatever is necessary when human lives are at stake? A few people downstream have raised the question now and again, but most have little interest in what's happening upstream. It seems there's so much to do to help those in the river that nobody's got time to check. How are all those bodies getting in there in the first place? That's the way things are sometimes. That's when I have to conceptualize healthcare. That's a little bit where I'm at. I think we are a little bit still in a system of rescue as opposed to health. And when we look at the WHO definition of health, they don't define health as an absence of disease, right? They define health as complete physical, mental, and social well-being, which essentially means we're not falling in the river in the first place. How do we stay healthy as opposed to how do we get well once we're not healthy? As a gynecologist, I am very skilled at treating incontinence, treating ovarian masses, fixing something once it's broken. But how much do I know, and how much do we know, and how much do we spread the word about creating health or celebrating health? And I think they're actually two different things. A mammogram after 50 instead of 40, a pap every 3 years instead of every 2. Where exactly do I fit in? And I hear this a lot, but what's interesting, this is still not creating health, right? This is finding disease early, which is really important. But is it creating health? No, it's detecting cancer early. It's detecting cervical cancer early. It's detecting colon cancer early. But we're not, oh, what do you need me to do? Oh, you can't? Oh, no. Oh, geez. Now you really can, huh? Oh.
What if I find something for you to stand on? Would that be better?
Maybe.
Yeah, I think so.
I have on high heels. I'll lean. How's that? Anyhow, detecting disease is not the same as preventing disease. And that brings up the concept, I think, of creating a culture of health. Right now, I think our traditional healthcare system, sorry, just wave at me if you need more microphone, may be more accurately described as a disease care system. And we're very equipped to deal with acute illnesses, with anything that's an injury, something that has a problem that can be fixed. But that's not what's going on in the United States right now. Currently, our largest burden is chronic diseases. They're not quick fixes. They're things like hypertension, cardiac disease, pulmonary disease. And in fact, the chronic diseases account for 75% of our healthcare expenditures, which you've all heard are out of this world compared to elsewhere without significant benefits. And chronic disease is the leading cause of death and illness in the United States. So just to take a quick look at kind of in women, because we're talking about women's health, what are the main causes of disease? And I don't want to make any presumptions, but I'm going to skip the 1 to 44 for all of us and move on to the 45 plus. Not that everybody doesn't look fabulous here. 5 major things: cancer, cardiovascular disease, respiratory disease, stroke, and diabetes. And if we look at cancer in particular, our 4 major cancers as women are breast, colon, lung, and uterine. Right? So what happens with chronic disease is very different than acute disease. Acute disease, there's a problem, you fix it, you move on. With chronic disease, it's a little different, and I think these numbers really help explain that. Right now, we have done a great job at expanding our lifespan. Women live to an average age of 80, but we're only healthy to an average age of 67, right? So that is 13 years that personally I want back. I don't want 13 years of poor health, but alive. I want 13 years of being healthy. And the majority of the diseases that are affecting those 13 years are caused by lifestyle choices. So there's a really cool study, and I think it was probably 8 or 9 years ago by the CDC, which looked at what can we do to narrow the gap between life expectancy and health expectancy. And what they found was 4 habits: good nutrition, maintaining a healthy weight, don't smoke, and remain physically active, led to a reduction in stroke, and diabetes, and cardiovascular disease by 80% and cancer by 60%, which is huge. We're not focused on that here yet. And I'm going to say yet because I think we're moving in that direction. I think actually the Community Health and Wellness Program is a huge effort in that direction to say, how can we actually create health instead of maintain or manage disease? And one of the places I think we can look to, and I don't know if many of you know about this or not, but it's called the blue zones. And blue zones are regions in the world where people live much longer and healthier than average. And what they find is that these people have low rates of disease, a long and healthy life expectancy, and overall much increased levels of happiness. When they actually look at life enjoyment factors, they're higher than we have here. The term first started in 2005 with Dan Buettner, who did a really interesting article in National Geographic, and I'm not sure how he got interested in this, but he did, and he was wondering, along with Michael Poulin, who some of you may know as a great health writer and a nutritionist, and they thought, what are the secrets, the places where there are people living into their 90s, their 100s, not just living, but living well, and what do they have in common? And they found 5 places in the world that really exemplified this. So there's Okinawa, Japan, Sardinia, Nicoya, I don't know how to say this one, Icaria, and Loma Linda, California, which is kind of interesting because of Parkview. We have actually quite a few graduates in Brunswick from Loma Linda because it's an Adventist healthcare system. And what they found is that residents of these places had a high rate of people 100 years and over. They had a fraction of the diseases that commonly lead to death in other parts of the world, and they enjoy more years of good health. And from this research, what they did is they distilled it down to, 9 lessons. And here are 9 lessons that came from the blue zones. I have a hard time doing things just boom, boom, boom. And so what I thought we'd do is kind of break the 9 lessons down and let's look at them in the context of, I think, what we tend to do in the Western medical world is talk about the health of the body, mind, and spirit. How can we be healthy in all 3? And I think there's a lot to learn from the blue zones in this. I'm happy to be interrupted too at any point. Feel free if I'm talking too fast or if there are questions or whatnot. So I'm going to start. Oh, okay. with respect to body health and nutrition, right now, 30% of our children are overweight or obese. Less than 25% of us are eating adequate fruits and vegetables. And 2/3 of us are either overweight or obese, with 35% of us reaching the category of obese, which is clearly not good for our health. But it's confusing, right? We decided, okay, we're gonna diet. Hold on, I gotta catch up to myself here. And what we know is that if you
Those who can't hear, I suggest they sit up front.
Oh, good idea. You want to come on up? If I were taller, I'd get closer.
That's something for you to stand on.
I'm sorry. I'm on my tiptoes and high heels. Anyhow, push back?
No.
Okay. Okay.
You need that.
Okay. So anyhow, it's confusing, right? This is what I think we're bombarded with, is I should follow a paleo diet, I should follow the South Beach diet, I should eat right for my blood type, I should do Atkins. But the fact is, any diet, it doesn't matter which one, only 5% of people will stick with even the maintenance phase of that diet for 2 years. So not even the hardcore first, 3-4 weeks, but the okay, now you can let up a little bit and let's keep some general rules in mind. 5%. That is not enough to change our health, right? So if we distill this down and we look at the lessons from the Blue Zone and we look at the literature from the United States, what we find is there's a couple of topics that really seem to make a difference. One is eat more plants. This does not mean be a vegetarian, be a vegan. It just means make your diet plant-based. Moderate wine intake, we'll talk about that one, and moderate caloric intake. And so if we wanted to find a diet or an eating plan that best represented this, what we'd look to is the Mediterranean diet. A good proportion, if you look at the Blue Zones, at least 4 of those Blue Zones, the way they are eating is in accordance with a Mediterranean diet. And I want to call your attention to a couple pieces of this. The first is it's not a low-carb diet and it's not a low-fat diet, right? It's a whole food diet. Whole grains, so white rice is not a whole grain. White rice has been processed. We've taken off all the vitamins, we've taken off all the fiber, we've made it nice and shiny and easy to cook, but we've lost all our nutrients. Bread, pasta, all of these aren't necessarily bad, but they're good in moderation and they're good in their whole, in their whole form as opposed to their refined form. Fruits and vegetables, and this isn't, again, I have so many people who come in and say, oh, I get a lot of fruits. I eat dried cranberries and raisins. Right? What's that doing? It's concentrating our sugars. And sugar in the United States is fascinating. The World, I might not have my numbers exactly right, but the World Health Organization recommends we get no more than 25 grams of sugar a day. And I'm going to be kind of vague on this one, but I think if I do the math, it comes out to about 2,000, a little less than 2,000 teaspoons of sugar yearly. How many teaspoons do you think we get a year?
Yearly?
Mm-hmm.
2 teaspoons?
No, 2,000 teaspoons, yeah. Yeah, 2,000. You're like, my God, I ruined it today. I'm done. No, 2,000 teaspoons a day, which, or annually rather, is a decent amount. So how much do you think we get on average annually as Americans?
5 times.
Yeah, you're totally right. 10,000 teaspoons annually. Ooh,
Try it.
Sure. Hi. Hi. Thanks.
What about the substitutes for sugar?
Ooh, does this work or not?
Yes.
Yeah? Okay. The substitutes are even worse.
Pardon me?
Yes, so artificial sweeteners increase the risk of diabetes. And there's a lot of studies on this, but it doesn't get out. So no, you're better off with, if you're going to have sweetener, a little bit of something. It's fine, something real, a little maple syrup, a little agave nectar, a little sugar, pure cane sugar. But yeah, no, artificial sweeteners no better.
about stevia?
Yeah, I have not seen a lot of data on stevia, but when you think about the whole brain part of it, I can't imagine it's that much different. But it at least doesn't have the chemical issues that the Sweet and Low or Splenda. It's a plant-based, yeah. I feel better about that than anything else, and certainly as a urogynecologist, which is really my area of expertise, artificial sweeteners in the bladder are terrible, but stevia is fun. Stevia doesn't seem to affect the bladder at all. So I think it's better, but I don't know.
I think the activity is the most important part. I'm 92 and I never stop moving, and that is the answer. I ride my bike, but you can walk. That's just as good, but you've got to keep moving.
Yes.
Kiss of death.
I agree 100, and they agree too. All right, so let me just see here. Drink water, right? No sodas, blah blah blah. Sweets we talked about. This is not a low-fat diet, as I said. Fat is not bad. I don't know what happened in America that we decided that fat was evil. You want good fats, right? In the countries in the blue zones, there's about a 2-to-1 ratio of good fats to bad fats. In the United States, we have about a 3-to-1 of bad fats to good fats. And I'm not going to get into all the details, but it's the omega-6 versus the omega-3. Omega-3 being the good fat. And it's about picking what you're eating. So things like avocado, nuts, olive oil, coconut oil, those are okay, again, in moderation. But Crisco, not so good. Say again.
Butter?
But you know, butter is interesting because butter being an animal product, right? We get into the dairy. Yeah, and so it's less the fat of butter that I worry about and more of the fact that it's an animal product. And so I think it needs to be grass, I don't want to go there, but grass-fed. I mean, just, again, as a gynecologist, I deal with hormones. And what we know is hormones are stored in fat. So if you're dealing with animals who have been given antibiotics or trying to be, fattened up, well, what happens? Their hormones increase. So if you've got estrogen in the fat of your animal, you're getting estrogen in your body, which is going to increase your risk of uterine cancer and breast cancer, 2 of the biggest cancers in women's health. So it's less the fat that I worry about with that. Yeah.
There's a very high statistic of how much butter in our country is sold.
Really?
Yes.
And is it?
Because people think it's healthy, because
right.
It's not frozen, it doesn't have additives in it, it's
right.
butter.
Yeah, and yeah, I certainly wouldn't recommend margarine by any means. I'd say coconut oil, olive oil. I'd pick butter over margarine any day. But
I thought margarine.
Absolutely, yeah. No, yeah. But not to say that butter in large amounts is. And if you're going to get it from a good source, which in Maine we've got the beauty of that. I'm not going to go through all of this, but this is the specifics. And if anybody wants a copy of any of this, right, we can do that. Yeah. So plant-based diet, moderate wine intake. I don't know how I feel about that one. I think most of the countries that are in the blue zone, with the exception of Loma Linda, because Adventists don't drink, do have a 1 to 2 glass, 1 for women, 2 for men, approximate intake. Sadly, I think in our country it's a little different, where we use substances for different reasons, and so it's hard for me to stand here and recommend that when I've got plenty of women who struggle with addictions in my practice. But if I have to look at the data and be honest, that's certainly there. And then the moderate caloric intake. How you eat matters almost as much as what you eat, right? So the Okinawans, who I really turn to because of the 5 blue zones, they're the ones who have the longest living, healthiest women. So if we have to pull out women, then we're looking at Okinawa, Japan. And they have a mantra they say before every meal, which is hara hachibu, which means stop when you're 80% full, right? It takes 20 minutes for the nerves in your stomach to get to your brain to tell you feel full. So if we stop when we're full, we're over full by the time we're really full. And literally before every meal, this is what they chant. That's the mantra, is to say, okay, stop. Most of the blue zones also use small plates. again, it's a visual cue apparently, and I didn't buy into this in the dieting years. I thought, oh, use a small plate, but there's actually data behind this, which is really compelling and absolutely holds true. Yeah?
Our plates here are small dinner plates.
Yeah.
They're not a full size.
Perfect.
But they're
Yes.
loaded, thank you very much.
Yeah.
They're loaded.
They're loaded, okay. Right, so it is a little bit about portion and the idea that when we're served large amounts, we eat more. When we're served a more appropriate amount, we eat less. And on that same idea, they don't do family style. They don't put everything on the table. They will serve in all 5 of the blue zones, serve and put the food away so we don't go back for seconds. And then the do nothing else, right? Mealtime is mealtime. It's not also checking your phone. It's not, standing up at your workstation. All meals are eaten as meals. And part of that is because we don't digest our food if we're in a stressed state. If we're stressed and our cortisol levels are really elevated, our stress hormone, right, cortisol, if that's elevated, our food is going preferentially to fat because your brain is reading, I'm stressed, I need to store energy, I better put it as fat. It's not using it as energy right then. And so those are kind of 4 of the takeaways with respect to not just what do we eat, but how do we eat. All right, there we go. Moderate physical exercise or move naturally. And I'll be interested in your input on this because I think this is a tricky one. Nobody in those blue zones exercises. They don't exercise, they move, right? They're doing things, they're walking places, they're biking places, they're gardening, they're involved, they're moving. They don't necessarily need to go to a treadmill or a bike. And unfortunately, our culture isn't that, right? So how do we translate the blue zone lesson to our real day-to-day lives? And to be honest with you, I don't know. This one gave me a little bit of a pause as I was up at 2 a.m. last night trying to figure out what to talk about. But right now, less than 30% of us get enough physical activity, and enough is only 30 minutes, 5 days a week. And it doesn't have to be exercise, it's just moving. And
That's the
that,
answer, yeah.
yeah, so what's the answer? So I put in what I know, but again, this is not blue zone piece. This is Western medicine. That when I think about exercise for women, I think about it as a 3-legged stool. We need aerobic exercise. There's no question you need to be moving because that's what really will reduce the risk of diabetes, cardiovascular disease, and cancer. So aerobic exercise, getting your heart rate up a little bit, moving is important. But we also need strength training, right? So when it comes down to things like osteoporosis and fractures, which are a big deal for women, you need some strength training. In both of those, so aerobic exercise, if you go back to the data and you look at it, and again, this is US data, this isn't blue zone data, walking and swimming are probably 2 of the biggest and easiest things to do. And they're as effective as anything else. You don't have to do anything. Like you were just saying, you can bike somewhere, you can walk somewhere. It doesn't have to be a great big deal. It's just get out, walk, swim. You want to say anything about swimming? Okay, never mind. Okay, coming soon. Strength training, there have been several studies at looking at, well, how do you strength train? Because I have a lot of people in my life and in my practice who come in and say, I can't do that. The 2 exercises that if you could do nothing else, one is resistance bands. Just using resistance bands 3 days a week has been shown to get people out of wheelchairs faster and actually get them out of wheelchairs. People who thought, oh, I'm wheelchair bound, even though they're strengthening their arms, it translates to the rest of the body, which is kind of fascinating to me. And squats, there was a really cool study on squats looking at people who just, right, you can hang on, you don't have to balance, you can hang on and just do this. And with that, what they found is that women who did squats over the course of 8 weeks, their grip strength didn't decrease as much as women who didn't do squats. Their timed up and go, which I don't know if any of you guys have had this in your primary care thing where you're sitting in a chair and they say, okay, I want you to get up from the chair, walk over here and come back. There's a certain value that's considered normal. the timed up and go in 20% of the people over 8 weeks, just 2 months, decreased in general, but in those who were in the squat group, it increased. So they were quicker, which is pretty interesting. And then I think the third leg of the stool is balance, right? We're not going to get a fracture if we don't fall, probably. So just having that balance for the risk of primarily osteoporosis and fractures. And the two that come out in that are really yoga and Tai Chi. Are probably the most beneficial. You want to add anything?
Feldenkrais.
Feldenkrais. Go ahead, tell me about it.
What you said?
Feldenkrais.
It's a way of strengthening your body.
Yeah.
And
Oh, there you are. Okay. I'm like, who is it?
and understanding your body and connection of brain and body.
Oh, the connection of brain and body, right? Huge. And that's one of the things I think that we lose in this society. We're not as good at that as listening to our bodies. What do we need? What do we want? Let's see here.
Playing games helps, doesn't it? With
So,
mind.
playing game, yeah, so this is, I like that you're bringing that up because playing games did not come out in the Blue Zones research, which is what I'm focusing on, but in the Western research, absolutely anything that is keeping your brain active reduces the risk of dementia. And I could go back, but I'll get confused how I'm going to do that. But if I go back, one of the top 5 causes of death in women over 70 is dementia, right? So we want to prevent that.
Well, sitting is the kiss of death, really, just sitting.
100%.
And I volunteer over Third Hall, and
Yeah.
I beg them to go up and walk down the end of the hall, and then if you're tired, come and sit down, then do it again. And
Yes.
eventually, you'll build up enough strength to keep doing it.
Exactly.
Yeah, but people don't realize that.
No, and I think the point here that's really important, and I have it later, is it's not too late, right? You might be sitting here going, oh, I wish I did that when I was 40. No, do it now. It is not too late to improve your physical health. It really isn't, and your mental health, all 3 of them. And then, so the other thing that came up in the Blue Zones was sleep. Blue Zoners nap. They like their naps. I'm a fan of that. And then getting regular sleep, 6 to 8 hours nightly. And I think the only points I wanted to bring up here is I think in our community with the number of chronic diseases that we have is often our sleep is disturbed by underlying medical issues that we're not addressing. So things like sleep apnea because of obesity or diabetes, right? If your oxygen level is dropping, you're going to wake up. Or if you're a little insulin resistant and you're getting a surge of insulin at night and you haven't had anything to eat, your blood sugar is actually going to drop in the middle of the night. And that's going to wake you up. And that's going to affect sleep disorders, incontinence, restless legs. So I think in my mind that's kind of number one, is address the underlying medical issues. But it doesn't mean we need to treat it with a pill, right? So there's a lot of great non-medical interventions. The medications we use for sleep in women over 50, they're not good. So we use anticholinergics, which we know increase our risk of dementia. We use any sedative, which increases the risk of a fall. So you want to be careful about just being prescribed something. And the data is really good on cognitive behavioral therapy, actually working with a therapist, which seems so silly, but every mid-coast primary care, as well as women's health and a couple others, we all have behavioral therapists in our office now because we realize that's huge. And it's not I'm going to therapy for the next 6 years. It's, hey, have 2 or 3 sessions and learn some skills. Exercise, improve sleep. Sleep hygiene as we get older. Our circadian rhythms, right, which is the way our hormones go throughout the day, and what should happen at night is our melatonin levels should go up, and our antidiuretic hormone should go up. And diuretic, you guys think, right, pee. Antidiuretic means don't pee. So both of those should go up. We should go to sleep and don't get up to pee. But somehow, with age, especially in women, that gets reversed. And it's a problem. So we wake up in the middle of the night and have to go to the bathroom, or we just, there's a flash of light of some sort and it wakes you up and it's hard to go back to sleep. So basic sleep hygiene, is it? Yeah. Yeah, right? Reducing the light, reducing it an hour before you go to bed. Simple little things. Taking the alarm clock and turning it away, which seems like, oh, is that really going to make a difference? It does. It really does. And blood sugar, which I hit on. Yeah. Oh, God. I can't even imagine TV in the bedroom. That's why. But yes, good point. TV off, right?
No.
Oh, somebody said, you didn't mention TV. I said, oh, God, of course I didn't mention TV. Yes, horrible. TV, any type of an electronic, because it just confuses the brain. The brain is seeing that light, and I'm not great at my physics piece of this, but the type of light we're getting from electronics is different than natural light, and it exacerbates the change in your circadian rhythms even more so than natural light does.
And you should read instead of looking at
Yeah,
television.
and read on a real book. Yeah,
Absolutely. Absolutely.
Yeah.
What about eating? Cutting off eating dessert?
Yeah, I don't actually think that's true. I don't think, in my, for a bit I was the medical director for the Healthy Weight and Lifestyle Choices group, and I did a lot of reading on that. I think stopping eating at a certain time probably cuts your calories, right? And so it's one technique to cut calories. I actually frequently will recommend to women who wake up in the middle of the night, have a handful of nuts, have a piece of avocado, have half of a hard-boiled egg, something with some protein and some fat, so that your blood sugar isn't dropping at night. Because these poor perimenopausal women who are having these horrible hot flashes, that's really what sets off a hot flash. Is you get a surge in adrenaline because of a drop in blood sugar, and that leads to a hot flash, and you wake up. So I don't think there's a lot of data other than by stopping eating at a certain time, you reduce your calories. Stopping drinking at a certain time, I have a whole different viewpoint about. Yeah.
I was going to say that.
Yeah.
I find that if I eat after about 10 o'clock
Yeah.
at night, I have one heck of a time.
Interesting.
Going to sleep before 2.
I see. I wonder I wonder if it's what you're eating.
What am I eating?
I don't know.
I make cookies.
Oh, well, there you go. Yeah, sugar, right? Sugar releases adrenaline. Yeah.
I'm also eating cheese and crackers.
Okay. So this is like an interest. I'm glad you're bringing this up. So the cheese part, I'm all for. The crackers. A piece of white bread is essentially like having a teaspoon of sugar, right? So if you're not having you're having whole grain. Okay, good. I don't know. Come back and visit me. We'll talk about it. Yeah.
My only thought is when you eat, the body has to work
It does.
for how many hours to digest that food
Right.
when it should be resting.
Right. And yet, right, if you think about what's our body supposed to do, we have our sympathetic system, which is our I'm on, I'm ready. It's the sympathetic fight or flight. And you have your rest and digest. So your parasympathetic system is activated when you're sleeping. That's also when you're digesting. So digesting food should not keep you up. That's not a normal response of the human body. It's kind of interesting. Yeah?
You had CBT on the screen. What does that mean?
Oh, cognitive behavioral therapy. Not that cannabis oil. Is that what you were thinking? Okay. I'm not telling anybody to have cannabis.
Your explanation, I don't understand that either.
Okay, so cognitive behavioral therapy is a very specific type of talk therapy where they teach you tricks to use your brain over your body. And it's kind of cool. It's a little bit like mindfulness, which I'll hit on in a minute. But it's not a long-term therapy. It's a short-term technique-driven, how do I stop my thoughts if they're going, or how do I work with my brain at night? Because a lot of people, what's keeping them up is their thoughts.
So you need therapy for that.
I hate the word therapy, right? You need education around it. Yeah, education around it.
Get that education.
So at every single one of the primary care offices at Midcoast, at my women's health office, we have integrated behavioral healthcare workers they're all trained in that. We actually pick them so that we know that they're trained at least in cognitive behavioral therapy, or CBT. Yeah. And there's a ton of great ones out in the community also. All right. moving on, now that we're talking about therapy to the mind, let me just see, all right. So stress reduction, yeah. So every one of the blue zones has some form of stress reduction. Some of them focus on taking a moment to focus on their ancestors. Some of them focus on prayer. Some of them focus on meditation. But it really doesn't matter. The point is something to take it down a notch. In the United States, I think one of the areas that we see a lot of good research and a lot more availability is in this world of mindfulness, which I think is kind of a nebulous term, so I actually wrote the definition down here, that mindfulness is awareness that arises through paying attention, right? Being present, paying attention on purpose in the present moment, non-judgmentally. It's the non-judgmentally part that I think a lot of us get caught up in, right? It's the, okay, this is what's happening right now. It's not good, it's not bad, it just is. And there has been a lot of research looking at the impact of mindfulness on our overall health. So not treating disease, but actually creating health. And this came from John Kabat-Zinn out of the University of Massachusetts. And it's got a buzz right now, but it's been around since the 1970s. And what they show when they look at the research on this is that people who practice mindfulness, whether it's a formal practice or just a way of life of saying, you know what, I'm going to stop for a minute and be present, have healthier lifestyle behaviors so we make better choices, reduce stress, improved outcomes if you've already got diabetes, cardiac disease, substance abuse, stroke, cancer, incontinence, truly, anxiety and depression, improved immune system, which is really fascinating, the data on that it shows that people who practice mindfulness, their T cells work much better than the average person would. Improved brain function, better quality of life, and reduced utilization of health services. Should I do a plug for the MBSR right now?
If you want.
Yeah. So that is actually, it was probably 3 years ago that when I was involved in wellness at Midcoast, that was one of our big pushes, was to get mindfulness-based stress reduction into the mainstream. And we now have several classes a year. There are 12-week classes, but we also have drop-in sessions. It's powerful. And there's info back there, right? Yep. Yeah. Okay. This didn't come up in the blue zones, but I can't leave it out when I'm talking about women's health, which is mental well-being. Probably they're so healthy they don't have to worry about depression and anxiety, but in our society we really do. This is a big impact on health in women especially. Up to 13% of women over the age of 60 are clinically depressed. And that's not even looking at the numbers for anxiety. Only 10% of women receive treatment. And I think part of it is because we put it up to other things, right? I'm getting older, I'm tired. I don't have as many people around me, so I don't want to get out and do anything. I'm not sleeping well. We come up with reasons, and yet there is a clinical issue that I think really needs to be addressed. Oops. And it does, depression in women shows up a little bit different, especially in older women, and here's our list, but I think the things that really called my attention that I focus on are feeling slowed down, right? So we know sadness is a sign of depression, but feeling just slow, feeling like I don't really have a point in life, the difficulty sleeping, difficulty concentrating, right? Often women we're working you up for dementia and cognitive decline when it's depression. More physical complaints and just withdrawing. So although I'm kind of diverging a little bit there, it's an important thing for me to bring up because I think it's something that we don't do a great job taking care of, and we know that depression affects every aspect of health, and if we don't treat depression and anxiety, and when I say treat, I don't mean throw medication at you. There's lots of treatments, both natural treatments, again, cognitive behavioral therapy. There's a lot we can do that doesn't involve drugs. Here we go, some of them. Right, find ways to stay engaged, adopt healthy habits, and then seek help. All right. Yeah.
It's healthy to do something productive where you see results, even if it's just a volunteer job. But I think that does a lot for your morale and everything else, as well as for the other person.
I think I planted you, actually, because that's exactly what we're getting to next, is spirit, right? What else? So we got the body, we got the mind, but what about, yeah.
I like what you had on your list before, the fidgety and nothing else is his.
Yeah, the fidgety.
And always rushing.
Yeah.
There's a woman here that once almost went through the door there, that Tim, our maintenance man, grabbed her because she's always on the go. She doesn't look to left or right. She has blinders on, so if somebody's near her, she is lucky that she has gotten hurt.
It's hard to be present when you're unhappy and depressed. It really is hard to stay still. Yeah. So moving on to the spirit.
I can't hear a word what you
No, I can't hear what she's saying.
Do you want me to repeat it?
No. Could you?
Well, I can, but it was about a woman who has blinders going through the door. I don't. Do you want to repeat it?
No.
Okay. But essentially, there's people who are fidgety and are like, you know, like zipping around and not settling, and that she liked the point. Correct me if I'm not doing this right, but you like the point of the busyness fidgety as one of the signs of depression that we sometimes miss, is that constant go, 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 and not being able to settle down.
Depression.
Right, yeah, it is, and it's an activated depression, right? There's different types of depression. There's depression where people are exhausted and there's depression where people are, and that gets missed even more. So moving on to spirit, and what's really interesting is 4 out of the 9 are focused on spirit in the blue zones, right? So of their 9 tips that they say, hey, if you want to live long, live healthy, be engaged and happy, here's what you have to do. And there are 4 things were life purpose, engagement in social life, engagement in spirituality or religion, and engagement in family life. Which I thought that was pretty powerful, that out of 9, it's almost half. And how much does our healthcare system focus on that, right? So if we're talking about celebrating health, where's this part of our healthcare system? I think you get it here, which is pretty cool. So there are 2 things in the Okinawa culture, because that's where women live the longest, called moya and ikigai. And moya is the social support groups, and ikigai is your reason for being. And they have specific words for that, which is kind of neat. And I think one of the pieces of data in women's health that makes me think this is really important is that one of the highest risk health times in our life is retirement. And so what happens in retirement, right? For those of us who are very committed to our jobs and use that as a reflection of who we are as a person, we're losing that. And even if it's just a job, it's a social support. You're showing up, you're interacting with people. And
well, that's the beauty of living here.
Right.
You get companionship.
Yes.
And you have to have companionship. You can take it or leave it, but it's very important.
It is so important, and you're completely right. The data shows it over and over. Connection is important. And I don't think we focus as much on that as we should. But so Moya, the social support groups that you're talking about, 15 years ago in the United States, women had an average of 3 close friends. Now we're down to 1.5. I can't even begin to guess why, because at 2 a.m. I didn't have enough time to research it. But is it the internet? Is it that we're getting more isolated? Right? Who knows? But we know that isolation is not good for health. And if we look at people who are isolated, who have a smaller group of interaction, we see an increased risk of heart disease, arthritis, depression, diabetes, and dementia. Well, my goodness, are those, 4 of the top 5 chronic diseases that are leading to the 13 years that we're losing as women, those 13 years where we're alive and unhealthy. I think that's pretty powerful. And the nice thing is it's reversible, right? So there are some things that we can say, well, if you do X, it's going to cause Y. But it doesn't mean if you don't do X that you're not going to get Y. right? So it's not always both directions. That just because we fix it doesn't mean it's going to help. But with isolation, it does. Improved connection absolutely translates to better health. And I'm going to go back to the point I made before, which is, and it's never too late. It isn't. And we can see women in their 60s, 70s, 80s increasing their connectivity with their, whether it's peers, family, anything. And you see a reduction in chronic disease. Oops. And then with respect to the ikigai, or your reason for being, right? Again, purposeful living has been linked to a lower risk of disease, improved sleep, and overall improved health behaviors. And there was, this is similar. Another JAMA study, and actually I think it was the same study, but it was looking at different things. Looking at grip strength and walking speed, again, in women who said they had a sense of purpose versus women who didn't have a sense of purpose. And what they found was over the course of 4 years, this was a longer study, the other one was like an 8-week study. Over the course of 4 years, that women over the age of 50, if they had a sense of purpose, it actually affected their physical well-being. It wasn't just their mental well-being, right? It was their actual physical well-being. Oh, and I'm going to harp on the it's never too late part. And the point of that is that there's something called neuroplasticity in our brain, which is the whole adage of, oh, you can't teach an old dog new tricks is bull, right? You can. Yes, you can. Our brains are plastic. We can grow, learn, and change at absolutely any age. And what might have been our purpose 50 years ago, which might have been parenting, let's say, or working, when that goes away, it's okay to find something new, right? And finding something new, something different, whether it's volunteering, like you're saying, whether it's a pet, whether it's a hobby, it doesn't matter. It really doesn't. It can be tiny. Even a little sense of, okay, this is why I'm getting up today, improves health. All right, and final thoughts that didn't come up in my talk because they don't quite fall under the mind, body, spirit. Sex.
Ladies, that doesn't come up.
But it does, right? So it is important in the blue zones. And if you look at the women's health literature, right, sex is not out of the question after a certain age. And I think we tend to forget that. In gynecology, I deal with that every day, so I don't forget it. But I think a lot of women just turn that over and say, you know what, my sexual being is gone. But in the blue zones, that is a big part of their lives right up through 100.